2023. Happy Valentine's Day to everyone. Lily, can you call the roll for us?
Mayor Condrey?
Here.
Mr. Richmond?
Here.
Ms. Cash?
Here.
Ms. Sipsey?
Here.
Ms. Lawley?
Here.
Dr. Patrick?
Here.
Mr. Bonnell?
Here.
Dr. Zollett?
Here.
Okay, do we have any citizen comments today?
No.
Nope.
No.
Okay.
We just have Olivia Hall over. You want to stand up, Olivia? Introduce yourself.
Hi, I'm Olivia. I'm the emergency preparedness coordinator. I started back in October. It's nice to meet you all.
Olivia, do you work in the health department?
Yes, I do.
Ah.
Mhm. She's one of our workforce development personnel, so she's another delightful staff member.
What's the definition of what she just said she does?
Emergency preparedness?
Yeah.
Stand up, Olivia.
One line.
Just one line, just yeah, what it kind of do.
Oh, one.
2 lines.
It's 2 lines. He gave you 2.
Currently, I am hoping to revise and update the emergency plans for the department. So that includes the emergency operations plan and the emergency response plan.
Yeah, our plans always, emergency plans have to be updated and have to be in place when you have multiple things, like we update emergencies for floods, earthquakes, pandemics, etc. And so you're gonna update anything as far as the protocol of who to contact, who to notify, etc. So those are just any kind of emergency plans, anthrax, any of the things that we kind of.
Commonly have, right?
Yeah, that we comprehend. Yeah, they laughed when we started in 19 about the emergency plans for a pandemic. Everybody was laughing. I said, well, this COVID thing is on the horizon and.
Does that
The rest of
mean
the
you're
story.
working with public safety also, or is it just health department emergency preparedness?
Well, it's mostly just the health department. Mostly the public safety is just a point of contact where it's like, how do I contact them? What information do we give them? That sort of thing, the protocol for that.
Because in a technical state of emergency, if the city of Middletown were to call one, the fire chief is the one who heads
He is.
Right.
Yes, he is.
We just
fire
put him in
chief is
charge all the
always-
time now, but-
Always, yeah.
I'm just kidding.
Yeah, that's right. So the fire chief, and what would happen then is, in the case of a pandemic, he turns it back over to health. But you work hand in hand with
Okay.
it. So it depends on what the emergency is, but that's who your out front
I
leader
hate
is.
to bring it up,
Yeah.
but since it's always every day, but does mass shootings, does that correlate to this at all?
Well, yeah, somewhat, yeah,
I mean,
you
it's
have.
medical.
Absolutely. Mass shootings usually will fall under making sure that everybody is aware of protocol with, different, what do you call it, protocols for, right now, I think AD is one, avoid, deny, and defend. They're doing like active shooter training, and they're now falling into this, it's called AD, A-D-D, avoid, deny, defend.
Well, I was thinking more of mass casualties or
Oh,
something. how that would
mass,
fit into-
oh, yeah, well then therefore the fire chief definitely would be over the mass casualties and whatever. Public health usually comes in the back as far as all the trauma and the cleanup, but but as far as mass casualties, yes. And we would work with, again, that's Red Cross. Public health usually, Carla, correct me if I'm wrong, but public health usually comes in the back end of most emergencies, unless it's a pandemic, because we're usually cleaning up and doing the surveillance piece.
Okay.
Yeah.
So that's usually what it is.
Welcome. Okay, do we have any comments or adjustments to the January 2022 minutes that anyone would like to speak before we make any motions to approve?
I do have one. Let me find it real quick here. For the 2023 election of President Pro Tem, the motion says Ms. Cash moves, second by Dr. Patrick, to approve the facility use agreement. And the facility use agreement was another issue altogether.
Good catch. Oh, and actually, this is January 2023 minutes, isn't it? Because you're on top of the minutes.
I am on.
That's right, yep, correct.
Okay, any other corrections? Okay, do we have a motion to approve the January 2023 minutes with the the correction that Ms. Lawley stated.
So moved. Second.
All in favor?
Aye.
All opposed? All right, a resounding unanimous approval of the minutes. Do we have any comments about the January 2023 financial report? Any questions anyone have about it? Okay, do we have a motion to receive and file the financial report for January 2023?
So moved.
Second.
All in favor?
Aye.
All opposed? Okay, motion has been approved. And today we have an education presentation on harm reduction. All right.
Great, good morning, everyone. Thank you for having us today. My name is Zoe Page, she, her pronouns. I'm a health educator at Caracol. We're the regional HIV service organization for Southwest Ohio.
My name's Leah Majeski. I'm a prevention supervisor at Caracol.
When Lee and I were asked by Ruth to give this talk about why harm reduction is important over the course of 10 minutes, we found ourselves a little bit overwhelmed by that concept. So Lee and I live and breathe harm reduction every day. So over the course of the next few minutes, Lee and I are going to talk a little bit about Caracol's work. First things first, just introduce you to our services, talk about some of our experiences in harm reduction and some of the facts and statistics around harm reduction. So what is harm reduction anyway? We think of harm reduction as a pretty broad definition. It can be anything from wearing a seatbelt, using sunscreen, and we can also think of it in our idea of harm reduction that Lee and I work on every day that encourages individuals to examine the connections between their substance use and their health and well-being and take steps towards any positive change. That any positive change is the key part of harm reduction.
Alright, so I'm going to give you guys a brief overview of Caracol. Some of you might be familiar with our organization, but we're an HIV services organization in Cincinnati. We're located in Northside, but we serve a pretty large region. So we do serve Butler County, and we're out here pretty regularly. But what we do is we serve people who are living with HIV. So we basically just like wrap them in services. Once they test positive, they can work with us through housing, case management, medical case management. We also have prevention, which is what me and Zoe do. We work on stopping and educating on HIV prevention. So we work on testing, harm reduction, health education, and we have a really great new program called Ending the Epidemic, which focuses on ending the HIV epidemic. Our housing is specifically for people who are living with HIV. That is something that Caracol, when we initially started, we started in the 80s as sort of like a hospice type of care. It was an organization that basically ran by volunteers, where people who were diagnosed with, people were diagnosed with AIDS, like almost immediately. People could go and have care and be treated with dignity and respect. Caracol has grown a lot since then, but the housing portion is something that has always been a core of what we do. So housing first is the model that we go off of, because we want to make sure that if folks have housing and shelter, then they can start to take care of other basic needs that they might have.
Classic story with that is that you're not able to worry that much about taking your medications unless you have a roof over your head. that's your number one concern. And at Caracol, we believe that housing is a part of healthcare. I recently saw a story from NPR of a doctor in Toronto that formed some kind of partnerships with the city services there, that he is able to write prescriptions for housing. So that just goes to show housing is part of healthcare. So prior to last year, I was Caracol's primary point person up here in Middletown and in all of Butler County. Since then, Lee and I both have been given a lot more administrative stuff, sometimes to our chagrin, since we love interacting with our clients. But I've been at Caracol for 5 years. And before the HIV cluster emerged last year here in Middletown and in Butler County, I always feared the emergence of a rapid cluster of HIV transmission. And in 2021, those fears were realized. Over the course of the HIV cluster in Butler County, 21 new HIV diagnoses were confirmed among Middletown residents. And many of those, Lee and I have tested ourselves back when we were boots on the ground. I fear, though, that without the harm reduction programs that we have, this number could have been far worse. We know from the CDC studies that SSPs are associated with a greater than 50% reduction in HIV and hepatitis C incidence. Through the course of our response to the HIV cluster and new HIV infections, we linked folks at the Syringe Services Program with life-saving HIV medical care. We had a very innovative partnership with UC Health Infectious Diseases, which we provided telehealth visits from our van. We have a mobile van that travels around the greater Southwest Ohio area. We have 2 compartments in it, and at the time we used the front compartment for testing, and we were able to use the back compartment for telehealth visits to infectious diseases providers. There were several occasions that UC Health physicians were able to prescribe medications to folks on the spot. And then our case management folks, along with us in prevention, did some troubleshooting with insurance to make sure that folks were able to get their medications the same day. And Lee is going to share a little bit more of an individual client level story of what that looks like.
Yeah, so just to share a brief story about a client that we worked with in Middletown. This is just a story about meeting someone at the syringe exchange. So this person tested positive with us at the Middletown Syringe Exchange, and so they tested with us, I believe it was in October, and they were on the younger side.
It was October of 2021.
Yeah, and I don't know their age, but they were on the younger side, and they were very scared, did not want to engage in services or, linked to any care with us or anything. They just wanted to go. But a few months later, we ended up seeing this person at the exchange, and they were getting their supplies. They walked right by us, and we just connected with them in some way. She just walked by, and we just kind of said like, hey, I didn't even know who she was, but she came back and just said, can I talk to you for a second? And we took her on the van, and she was someone that we were actually looking for because we wanted to get her linked to medication, linked to medical care, and the only reason I'm telling this story is the syringe exchange was the reason that we were able to not only test her, but get back in touch with her to help her get into medical care, and give her education and support because she was really scared, and because of all the stigma around HIV, she didn't really want to tell she didn't really have any support, and she didn't want to tell any of her family or friends. So it was just a very cool situation where we did have this situation where she didn't want to engage with us, and then we ended up getting in touch with her again. And she also was utilizing the harm reduction services that the county at the time was providing.
from the public health epidemiology side of things, we were very concerned about this person. She's young on the clinical level. Of course, she was young, she was scared, we want to provide that care to her. But we also heard from our partners at Hamilton County Public Health. They send out disease intervention specialists anytime somebody is diagnosed with HIV to do contact tracing. And this specific person, her name came up multiple times during contact tracing, so we were pretty concerned from an epidemiological and public health side of things too. So when we finally saw her, that was a huge breakthrough for us. We were pretty excited to see her. So we know from our statistics, from our day-to-day work, that drug use is, and will happen in our communities. Lee and I certainly see the very real harms associated with drug use on a daily basis. We've lost clients due to overdose. We've lost clients due to fungal and bacterial infections. And it's horrible to see, especially with those fungal and bacterial infections, how painful and excruciating that form of disease process looks. We know all too well the overdose statistics, the rates of HIV, viral hepatitis, those illnesses from bacterial and fungal infection. Harm reduction seeks to reduce those harms as best as we can. It's as best as we can any positive change through education, provision of those supplies, and relationship building. One of our former co-workers, Rob, if any of you ever got to meet him, I think you did, Jackie, at least, he often said that the opposite of addiction is connection. So those of us in harm reduction seek to make those connections every day in our work. That is our central guiding light, if you will.
So gonna tell another really quick story just about like harm reduction and just like the trajectory that someone who I've had contact with for several years, this person basically has been a participant of our syringe exchange at Caracol. So when I first met her, I would say I met her in 2020. She was actively injecting drugs. Throughout the time that I've known her, she was always a participant at syringe exchange, so she would come regularly. So throughout this time, I don't know exactly when, but she started smoking her drugs, which is much safer than injecting. So she kind of made this switch to injecting to smoking. This past year, she started taking pills and is now in treatment. And I just tell this story because her engagement with us and just being able to see this, like, I guess, like, progression that she's made is just really amazing. She's been able to, like, get, new syringes from us. She's been able to utilize our vending machine here. We have a vending machine in Northside where folks can get safe use supplies. So she was able to get, like, safer smoking kits and naloxone and fentanyl test strips from the machine. And now she is in treatment and utilizing those services. So I just wanted to share that as like a really great story of how harm reduction works and just like the relationships and the connections that folks can, build and how it really works.
And that's a perfect example of any positive change. That this person probably wasn't ready to enter into treatment the first time she engaged with us. But she did want to change her behaviors to be healthier. And that's what she did. It took some time, it took some relationship building until she was ready to go into treatment. And we also know that not everyone wants to go to treatment. And our job is to keep them safe in the meantime. But we do know that folks who participate in syringe services programs are up to 5 times more likely to enter into treatment. Since at a comprehensive syringe service program, those referrals, those resources are going to be available on site. Lee and I, in addition to our HIV referrals and our HIV work, we're often called upon to make those referrals as well, and referrals to many other social services. So when folks are ready, we're there for them with the relationships that we've built with treatment facilities and other social service providers. And there's been a number of times working in harm reduction as well that I've seen that moment when somebody's ready to enter into treatment. And it's a powerful moment to be with someone during that moment. It usually starts off with them coming up to me and just saying, Zoe, I'm tired. I'm done with this. And I say, okay, let's go. Are you done right this second? Because I can get you in somewhere right this moment.
99% of the time, those are the exact words that people say to me too, is I'm exhausted.
Absolutely. So that's one of the other services that harm reduction provides as part of that path to any positive change. So I believe we've probably went over our 10 minutes because like I mentioned, it was a pretty daunting task for us to fit this in 10 minutes.
We did bring some information about our services, our harm reduction services guide, and then some information about our harm reduction vending machine that we have in Northside. The vending machine is free for people to use. They just sign up with us. They get a code, and folks can get naloxone, they can get safe use supplies. It does not have syringes. We're hoping one day to be able to have sterile syringes in there.
What keeps
but
them
that's
from giving
not-
that code to somebody else?
I'm sorry?
What keeps them from giving that code to someone else?
People do give it, they do share it. There's really nothing that we can do. We ask people not to, because.
Because that defeats the whole program.
Yeah, we ask people not to do it. Actually, people don't want to do it. From what the experience that I've had, people get upset because they'll say like, I let my girlfriend have my code, because there's only a certain amount of items that you can get. So you can get each item once every 7 days. So when people do share their codes, it really hurts them when they wanna come back and get other things. And I've had a lot of people ask me if they could switch their code because their roommate had their code, or someone else knew their ex knows their code, or whatever. But we usually ask people to give us the last 4 digits of their social. So it's like a code that they know that they're not going to forget. But, you know, occasionally there will be duplicates in there, so we'll have to add on a number or something. But yeah, the machine is like I said, there are not syringes in the machine at this time, but like I said, it has Narcan, fentanyl test strips, and it does have safe use supplies. We have over 1,000 people who are signed up to use the machine. So it is something that is really doing a lot of good in the community.
It's only one machine so far in in Southwest?
We're the only machine that has the supplies, like, we are the only ones that have, like, and there's a machine in Brown County, but I don't know what all they have in their machine.
Primarily Narcan, they have some hygiene supplies in there, but I don't believe they have some of the safer use supplies and harm reduction supplies that we
Yeah,
have.
and other machines are popping up all over, and they're all gonna have different things. This is just the only one that we have, that I know
Okay.
for
Oh,
sure
that you
what's
know
in
for
it,
sure.
yeah. But
we
they're
were
popping up
the
everywhere.
second one in the US, the second harm reduction vending machine program in the US, so we've gotten so many requests for technical assistance from health departments and community-based organizations, from New York to Seattle
All over the
to
place.
London.
Yeah. The place that we kind of like used as a model was in Las Vegas. So they have like a lot of machines in Vegas. They dispense syringes and other supplies. But yeah, ours is really getting a lot of Narcan into the community, which is great. It also has pregnancy tests and sharps containers, and we really hope to get some wound care kits in there, and maybe some pads, tampons, and some other items like that too for people.
Are there any other questions for us? We more than welcome those.
Thank you.
Well,
Thank you
thank you
very
all
much.
for having
Thank
us
you guys
today.
for having us here, we really appreciate it.
I appreciate all that you guys do.
Thank you.
Thank you, Commissioner.
Thanks a lot.
We'll try our best to be quiet as we
Oh,
go.
no, you're good, you're good.
Okay, next on the agenda, we have old business with Fab.
Oh, business
there.
for Fab, and I do know I was out on the last CHA. Carla, do you have any update? The CHA is, remember, the Community Health Assessment, and that's what we're going through, the new one, on our new, and I know, Chandra, you were out on that one, so you didn't know. So we were still just meeting, we met, had probably a large crowd. I talked to Suzanne Prescott, that said that she was there. Talked to a couple of people who said that they were there. They're still working with the community. Take care.
Thank you.
They're still working with the community, getting all the new health assessments, and we have not started the survey yet.
No, just continually trying to work out the kinks.
Kinks of the
Right.
questions and how to get it out.
Mhm.
So that's just the update with, put it right there.
Okay,
And I think Ruth has been a part of that process. Do you remember, the last time that we had done this process, they wanted board involvement, and Ruth is checking off that box, so thanks, Ruth, for my next.
thank you. Okay, under new business, we have travel authorizations. I think I saw a couple, just some local miles
Yeah, just,
for Chandra.
local activities for Chandra, yeah.
Okay, do we just make one motion to approve both, is that, okay?
Yes, and, we were looking too at the policies too. I think if you're traveling with cost under $20 and if you're within a 100-mile radius, it doesn't even have to come before the board, so we're looking to make sure that we don't weigh us down, but remember, we didn't travel forever, so we always kind of put our
Right.
travel request, letting you know what we were doing, so just in case, but these are either nursing director meetings or infectious disease kind of,
Infectious disease training.
trainings or whatever, so it's this kind of either continuing education information or updated information that the nurses
Mhm.
are getting, so, yes, so you can
Okay.
do them together.
Do we have a motion to approve the two travel requests in the
moved.
packet?
Second.
All in favor? All opposed? Okay, enjoy traveling a few miles away.
Yeah.
Okay, and next we have approval for a public health worker agreement with Deanna Shores. Did you wanna talk to that one?
Just reminding the board that our workforce development grant continues with Ohio Department of Health and the CDC, and we always have the ability to hire public health workers or engage the community in doing some work for the health department underneath that grant. Deanna will probably be, if you guys were to approve this, to help us with our facilitation with our CHIP and CHA, because we have to do focus groups in the community. So she usually has the ability to bring people together at different churches or community center or whatever, different diverse people, and just facilitate the discussion. So she would just be paid for those group meetings, I guess, so that's it.
And so the rate, so that's paid directly to her, or is it paid
Directly
to
to her.
to safety council?
No, it's directly to her.
Okay,
It is not with the safety council. We could also use, remember Deanna's a part of the safety council and the Ohio Is grant. And so we're doing a lot of, information there too. So it's a good match as we keep getting community residents involved in discussion about safety, health, et cetera. And so it could be a continuance too. So it's a good shared match, if you will, so.
and is this a position that is floated? Or, I mean, this is directly working for the city of Middletown, right?
Right, it's a contract.
Contract.
Contract person.
Okay.
So I don't know what you mean by floated.
It's not, the vacancy isn't listed somewhere?
No,
You
it's not a
just-
vacancy.
okay.
No. And we could
But you
get others.
don't have to put it out to bid as a contract?
No, not as a contract, no. No, we're underneath, we don't have to do that.
Okay.
And we can bring on multiple people if we want to. That's what public health, the whole workforce development grant is, to introduce regular individuals into the public health arena with the terms and terminology and et cetera, so. Yeah, we can bring people in and out to do a lot of things, like when we had the nurses or health educators or anyone, we can kind of bring them in and out underneath this grant.
And does it have like a maximum length of time or hours or?
I think we did put that, I think we do a PO, I can check with, Nancy, but I
It
think
just seems
anytime
like
you
a
have
really loose, open-ended process, like.
purposely, yeah. I think we don't, when I say purposely,
government?
yeah, when I say purposely, I do know that the
Terrible idea.
PO, I can get Nancy in here, but we always say how long, how much, and we usually say it's under a certain amount, so it's gonna be under 5,000, or under, it's, you know what I mean, in the PO part, for the finance department.
Yeah.
Cause they have, these people have to be paid through, just like, Olivia, they have to be paid under a PO, and you have to say how long will they be there, and how much money do you think to expend? And then they put the
Right,
finance.
I just
percent
look
in
at
there.
like when the Board of Health approves something, this is just open-ended, like this could go forever for however much budget, she could work 200 hours a week.
Yeah.
I just look at like loopholes and.
Yeah, and no, but we do know, and I can check with, again, with Nancy, we do know that when we hire people, we make sure that it's underneath the grant, that we can afford it, and that we can discontinue at any time, and usually it's always underneath the amount that the grant is, if that makes sense, so we don't. And I think, Olivia, you're now working 25 hours, I think, and so we take 25 hours and her cost per hour, and we make sure that we can cover that. And we, you know what I mean, before that, we don't extend it, and she knows it, and Deanna knows it. I can get you those amounts if you.
No, I just, it's weird that it's not written into the
Yeah.
contract. I think it's a lot to ask of the board to just approve an open-ended contract, but, okay. Just my, you know me. I'm
Yep, I know.
Cool. Does anybody have any questions about the public health worker agreement with Deanna?
She's very good.
I think we've worked this past Saturday with Ohio Is and the ambassadors. We are continuing to get a lot of information that would serve the city well when you start getting deep down into residential's thoughts and processes and concerns about their community. And so, I mean, that's what we're hoping to do, just keep digging down deeply to find out how we can serve them better as a community and as a city, so.
How do we guarantee that the work that she's doing isn't getting almost double charged under the Southwest Ohio, the Safety Council?
Oh, because we will pay her straight for those facilitations of those CHA groups. I mean, those, you know what I mean? When we bring together, when we do the CHA groups, what do you call it? The focus groups. We're asking them the actual CHA questions and this, so.
Okay,
Yeah, so she's not gonna she won't be able to bill that, and Christy would know too. She wouldn't
Okay.
be able to bill Safety Council for that. Christy knows that she's working here, and Christy knows it's a nice, collaboration, if you will. Because after a while, when you're working with the community, there will be overlap. But when she's working for us, it would be at a said place for a focus group for those said hours.
okay.
And unfortunately, or fortunately, we'll probably be there too, health department, because we're a part of that process of the job, so. We should be able to keep them pretty clean, but it will be some overlap when you go out and you start doing things. It may be something that springboards into your other groups, you know what I mean, something that, a gem that you find, that you use in another group and say, we talked to a group last night about X, Y, and Z, how do you guys feel about the same question? And you can kind of get some more information, so. But she definitely won't be paid when she does that on the other side from
Right,
us. Yeah.
right. Okay, sorry, I'm asking, does anybody have any other comments?
Okay, questions.
Okay, do we have an approval for the City of Middletown Health Department Public Health Worker Agreement with Deanna Shores?
So moved.
Do we have a second?
Second.
All in favor?
Aye.
All opposed? Okay, the agreement has been approved, and next we have 2022 annual report. We don't have to approve this report, right?
You don't have to
We're
prove it,
just-
this is just presented every year to the Ohio Department of Health by the 15th of the month in January. So we always put it in the packet, the February's packet.
Okay, and are you guys going through it with us, or we just have questions?
If you have any questions, yeah, if you have any questions, this is this basic. Now, the FAB, the Public Health, I keep saying acronyms, Public Health Accreditation Board will require us to do an annual report. That's due, I think, Carla, next year. And it'll be it's an annual report, but it's completely different than this. They'll wanna know how we're doing on our community improvement plans and that kind of thing. So this is kind of leftover from years of ODH requesting us to summarize our year. And we usually put our financials in there, our staffing in there, our board changes in there, just different things that the state requires us to do in the annual report. I think FAB will want more detail, like trends, up and down trends and things like that. They will want us to analyze, what are we seeing, getting better, getting worse, those kind of things. So it'll be a little more in depth.
Anybody have any questions or comments about the report? Okay. Now we have our new.
We have,
Yes.
yes.
We got an open discussion. So I'll kick it off because I got a couple of things.
Good, yeah.
I sent an email, I think it was just yesterday, but I figured it was worth kind of discussing at the Board of Health. I received an email from a citizen who's working with this group of girls. They made all this money for charity through a lemonade stand. And I was like, oh, that's cool. And they invited me to come. And I'm like, yes, I'd love to. And then I immediately forwarded it to Carla and Jackie because I was like, oh, I've seen very well-intentioned things end up in the newspaper because they didn't have a permit to sell lemonade or whatever it might be. So would you be able to speak to that? I don't want to crush these girls' dreams, and end up you have to have a permit for your lemonade stand. But at the same time,
Very good, that's very good saying, Mayor.
Yeah.
But no, Carla and I talked about it, but real quick, I do believe Diamond Loop, just FYI for your information, the address is Lemon Township.
It's not in Middletown.
So that's just for you to know, but you can go beyond that
Great.
sometimes because I've often,
sell all the lemonade you want in the
but I've
township.
often done things in the surrounding areas, Madison included, so you can cross over those things, cause they don't really have a mayor.
Oh
and
yeah,
you
I don't
kinda-
mind it. Yeah,
And
yeah.
they're in,
But
the
it's more
Diamond
the
Loop is
health
down there right off
department
of,
piece.
isn't it? But then Carla, we talked about this last night, so I'll let Carla take it as far as.
Well, it depends, she can have they can have a lemonade stand from their residence if they're 12 and under, and they don't need a license.
Okay.
So they can do that.
They're 13, they
They-
can.
I'm gonna need to see your ID, little girl.
And it has to be from their residence, and they have to be 12 and under, so they couldn't set up in, Walmart shopping plaza and do
Okay.
it, or Smith Park without a license, but if they're at their residence, they can do it.
And can they sell anything?
It's
Oh,
lemonade.
Just
Lemonade.
lemonade.
Yeah.
Yes, no beer.
I mean, if they're 12 and under, I wouldn't, if it's a drink, of course, I mean.
Yeah, I'm just,
yeah,
because of course there's then where's the one, I
Right.
just wanna make sure,
Yeah,
no.
yeah.
And then Carla, go into a little depth of sometimes when they want if they ask for donations, it's
Yeah.
allowed. You don't, as long as you don't ask
Ah,
for
From
25 cents.
a commerce
for- yeah.
perspective,
Mhm.
right, sales, that was my other thought, but it's not in your realm, but sales tax and.
Right,
I mean, they don't have a nonprofit, obviously. I'm just
Right,
thinking, I
right.
know it's
Sales
terrible,
versus
but last thing I need is that to,
Yeah, there's-
anyone doesn't want that.
Yeah, and there's so many exemptions, it's
Right.
ridiculous, so,
Okay,
but,
and then also Carla, why would we be concerned about lemonade?
well, you would be
I mean, as far
concerned.
as health, on the health
Yeah,
side.
you would be concerned with anything that you're preparing with your hand, because you can always, there's the room for contamination. So you would wanna make sure they have appropriate, setup for hand washing
And they're
and
not,
protection of the product and things of that nature.
Sharing cups from one person.
Yeah.
But if you 12, well, yeah, we don't care about that.
Yeah, yeah.
Yeah, so.
Your germs
Okay.
aren't really, your germs aren't mature at 12.
No, I've never heard that.
Let's go with
I
that
just
one.
made that one up. Yeah.
You don't need a permit for a gun, but you need a permit to sell lemonade.
Lemonade.
Yeah, there you go.
Here we are.
Uh-huh.
So there are numerous.
Well, I'm hearing we don't
exemptions.
need a permit, we don't,
No, you
12
don't
and
need,
under.
oh, well, if you're under 12
Yeah.
Yeah.
or under 13.
Okay, thank you. I don't wanna drag that one out, but interesting concept. There was something, a citizen complained about, a couple years ago. Someone was giving out lunches or hot food or something to homeless or some people in need, and a citizen complained about it. It was a kid. And, it made the paper, and
Yeah.
I was like,
Giving away is called at your own risk,
okay.
right? And so we tell communities that all the time, when they go to basement tattooing. If you don't see a license on the wall, all of that's at your own risk. People can certainly do it. Is it, legal and allowed? No, but people certainly do it all the time, and you can hand out food.
So like if you were having a block party, let's say, no one's paying.
You can certainly serve hot dogs and give them out.
Okay.
Mhm.
These are all good things to know, because
Yeah.
if you're in the community as a Board of Health member and people ask, those are like the most common questions that I've
Right.
gotten.
Is there a connection between the thing I read about the Phoenix Metals? Don't they have a food stand in?
Right, they are licensed.
They are licensed?
They are licensed, yeah.
Okay.
Yep.
And and we always go back to just letting you know, when you're licensed, then you have responsibility to know how to keep food safe. And so we go through all that with them, right? And so that's the reason why the license says that they will prepare the food, keep it cold, food cold, hot food's hot, make sure they have good cleaning and disinfectant and that kind of stuff. Once you're licensed, when you're not licensed, then it's at your own risk, and if they're selling it, then you have the right to say, do you have a license? And if they just say no, this should be free, this food, no. This piece of pizza should be, no. So, yeah.
Okay, the second thing that I am getting bombarded
Oh,
with
no.
is the feral cat feeding. I know the city's been through it. I looked at the videos from the past before I was here. People are claiming there's a correlation between increases in skunks, and then there's coyotes, and then it's in my front yard. Like Smith Park is my front yard. I, if anyone, am the most affected. However, I have not complained about it because I don't want to cross that line. But at this point, citizens are bombarding me, and I don't know if there's a health issue with it. I don't know what it is. I don't have the research on this, but I thought I would raise it with the health department because I think it's a piece to the puzzle, and I don't know what to do about it. But it is out of control, the feral
I
cats,
agree.
and people are feeding them. There are shelters in Smith Park for them, and they're increasing. So I don't know, do you have any thoughts or comments? Have you guys done research on it?
Oh, Olivia has her hand.
Olivia, what do you have?
I, first and foremost, am a cat lover. I do not feed feral cats, okay? I live downtown on Central, so we also see a lot of feral cats down there too. My greatest opinion, as high as that may be, to you guys, would highly recommend TNR, Trap, Neuter, Release. There's a lot of different programs in the area and across the country, and basically what they do is they are non-profit organizations usually that will go out, they'll set traps for feral cats, and they will take care of their neutering and spaying, and then they will release them back into the community. It's the most humane way to deal with feral cats, and it will help reduce populations over time because they won't be, procreating, reproducing, things like that. So that is what I suggest.
And to that, based on research I've done, if a cat is fixed, neutered, what have you, they don't draw in other cats either. It keeps other cats away because there's no need. You're not getting anything over there, so.
So there is an animal nonprofit. They are responsible for the feeding, Joseph's Legacy. They're actively making posts and trying to get people to come on certain days to feed the
I've
cats.
seen that, yeah.
So I don't think they're definitely not trapping them. So we're at like the opposite situation where we have a humane society who's doing the opposite.
Or do we know that they're not doing that? Because I used to think, remember, you guys that may have been around for a while, Steve Dillman, I thought he was in a group where they were trapped, and, although they were feeding them, they were doing the, neutering as well. Do you remember that?
Yes, I believe
yeah.
it was, yeah.
So I think there is a group that is still, going around and, and neutering and doing that part too. We can maybe look
guarantee that
into it.
because anecdotally, I'm there every day, and
You don't
I've
see anybody
only
trapping
seen
them?
feeding, never seen anyone.
Trapping them?
I'm not saying maybe
I got a
it's,
couple of those.
I mean, I'm not there 24/7, but you would think at some point I would have seen that in the last 5 years.
Well, Steve and Brenda say that they're through with that,
Oh, they're not doing that anymore?
yeah.
Uh,
And the other thing I want you to know, just in case, you know, if you're wondering if has been neutered or whatever, veterinarians, have a, where we clip the tip of the ear
They
off.
clip the ear.
So
Or,
you have you ever
or a
seen
little
the little tip off
V-shaped
their ear?
notch,
And they-
and that way you don't have operating on the cat a second time.
ah,
See, that's a good, yeah, that's good,
So you can visually see that.
Yeah.
I have a friend who works at OR, the Ohio Alley Cat Rescue, which is one, like in Southwest Ohio, that is highly active with TNR programs. I can reach out to her to see if they're up here at all.
oh, yeah,
Doing
maybe we
that.
can do some research.
And
and see.
then, of course, I have friends in the rescue community that, can probably reach out to Joseph, somebody higher up in Joseph's legacy to see whether or not they are doing TNRing.
Why don't we do some
But
investigation?
I just anecdotally, I can say that cats, I've not seen that cats bring in skunks. If anything, they're gonna like detract them.
I'm really looking in this case for
coyote
not
level.
anecdotal information, because we can all provide that.
Right.
I don't know where the facts are on the matter, like, there's clearly there's some circle of life research that someone has done on what is the result of, like,
Right.
a high population of feral cats, and is it correlated or not? And, because we have got, if this is gonna be brought anywhere, facts have got to be involved.
I got you.
Because I watched those videos on the news and whatnot from like 2016
Mhm.
here
Oh,
in
yeah.
Middletown. Yeah.
And
We
I
need to
wanna
go through that
say,
again.
would it not, while we're discussing this, and Dr. Patrick, just like when we're cutting down areas around where the homeless, I'm sure we're cutting down areas where the cats and the animals stay, because I live on Main Street, you're over there, and I get a little bit of everything. I mean, dog killed 3 groundhogs last summer, and I mean, I'm getting a whole lot of stuff, and then people are saying they're seeing skunks. So I'm wondering why we are seeing so much wildlife in cities, not city, but, I mean, it's not uncommon that you see skunks, and I don't remember seeing as many skunks as I'm seeing now. And so, and we're not out in the country per se, you know, where we would see that, but we're seeing a lot of groundhogs, a lot of skunks, a lot of raccoons, and I thought raccoons only came out at night, but they're out in the daytime, so I don't know what's kind of going on.
And we're reading about the coyote problem all over the place increasing. I'm getting citizen concerns about coyotes. I don't know enough about this topic, but I
Yeah.
feel like
I
something.
don't know, I think I live by the Arboretum.
Oh, yeah, you
And
would have a
we've
lot of
got-
stuff over there.
We've got everything coming through.
Sure.
We even had fox.
Yeah.
Now, I haven't seen any in the last year or two, but I used to see fox maybe once or twice early in the morning, when I used to get up early in the morning, and,
Yeah.
you know, about 6:30, they'd be coming by. So and we do have recently some skunks.
And these big buzzards, these big
Those I
turkey
haven't
buzzards.
seen.
Well, they were right on
We
Main
have
Street
some
in my
owl-
neighbor's house.
We have some owls and we have some
Yeah.
hawks. We have a
No,
couple
these,
hawk
this
families.
big, this
I
bird
saw,
this
I
big.
saw one on my street. I live on
Yes.
Ardmore. I saw
Really?
one.
Yes, I mean, they're this
So-
tall with little black heads and red heads. They're
Yes.
turkey
And I
buzzards or
drove
something.
past, it and it just looked at me like, what are you doing?
What are you doing in my neighborhood?
So, I mean, do you know what's
Well,
going on?
one of the reasons.
Yeah. Your time to shine. You got it?
One of the reasons is that we have destroyed so much of their habitat
Mhm.
that they are now coming closer and closer to us.
Mhm.
Is there an agency who's responsible for wildlife in Ohio locally? I mean, how do we get the answers?
I'm laughing because New York, I just left New York and the mayor's got a rat czar trying to get rid of the rats, so
Mm.
I just laughed at that because I'm like thinking rat czar, okay, so we need a wildlife czar.
I mean, I'm trying to stay factual about this and not
Right.
like bring emotions and personal prejudice about whether you like cats or not
Right.
into the discussion, and it's
I agree.
difficult because we all have our opinions. I'm sure we could all say yes or no on the issue immediately, but that's not really where we need to go with it. It's like, is it a health wildlife health, whatever concern or not, and I don't know how to find the answer.
I think what we can do is, Chandra, like Chandra said, we can look and see how active, if we have any of the TNRs here, if they're active, we can look at the other organization, as well as look at animals and diseases in the community, to see if we do, we can, you know, to see if the increase in skunks and whatever, and coyotes bring about increase in, you know, diseases, and we know that coyotes aren't good for small.
Are you seeing many deer? We have deer.
Yeah, no, I don't. I've only seen 2 deer on Main Street.
A couple of years ago, I think we had 10 or 12, and then they kind of went down, and then now they're back maybe 4 or 5.
I mean, if we wanna talk about a safety issue, I will say, I listen to the aircraft radio every day at the airport, and there are constantly aircraft talking about coyotes on the runway.
Really?
Yes, and it is safe, it is for sure a safety
Interesting.
issue, yeah. Now, for what it's worth, when we look at the ramifications, if there's a correlation between feeding cats next to the park, and now the food chain cycle has gotten to the point where there's coyotes across the runway and a plane crashes from the coyotes. I'm just saying, I'm trying to think of like, how do you connect what the issue, what is actually, so that is one that I have directly seen has increased, so.
Cool.
I don't know, just bring it up because I've been asked to, and people won't stop asking. Thanks for the great conversation. Any other open discussion items you guys wanna? I didn't stir the pot enough with the feral cats. Okay, that brings us to our reports. We've got Health Commissioner Jackie, what do you have for us?
Just really quick, the Ohio which is the Middletown Connect grant. We were looking at all the things that the residents are saying so far, and we were putting it together, you know how you have those word clouds or whatever? And so we thought about starting an initiative called Walk and Talk. And this is not necessarily original, although we thought it was, but when we were starting to look at it, other cities has kind of done something around it. But Walk and Talk would be an initiative to start connecting with your community. So you're gonna walk your community, walk your neighborhood, and talk. So we are telling our ambassadors and others to invite somebody to walk and talk with you. We will be asking city department heads maybe to walk and talk, city manager, city council, school board members to walk and talk. So you're getting exercise while you're walking, you're connecting, getting to know people, but you're also telling them of your concerns and ideas and wishes and dreams, etc. But that's another way to kind of get the community out to start connecting with one another, but also to start hearing from other voices. And so they would, and when you walk, as you know, I drive Main Street to the city building, but when I walk to work, I see a lot of different things every day, between the trees changing and houses being repaired, or houses I didn't even recognize before I noticed. And so it makes you more aware. And so you'll hear more about that, but it'll be a campaign. That is with the grant. We may have hats that says Walk and Talk. So we may start taking little pictures or whatever to see more people walking and talking. So what we're trying to do is get people out into the fresh air, start increasing their activities. Hopefully it'll decrease their weight, decrease diabetes, decrease obesity, all the things that's healthy for us to walk, as well as getting connected.
It's okay.
As well as us getting connected.
Come here, no one's gonna kick you.
And then,
She doesn't like that.
She hates the feet, and every time someone moves them, she's like,
Slight panic attack. And then, last but not least, before I left, and then after, yesterday, they had another One Ohio conversation. One Ohio is the information that we sent out to the board with the opiate money. And they were shooting for that last push to see if, Butler County could get more money, the structure. I think we have leaned to the point we're probably not gonna get that.
Yeah.
And so they're talking about how they're gonna start trying to spend some of the money. And we also spoke about, can we just get pots of money and get percentages to it? Like 1% goes to prevention, 1% goes to treatment, 1% goes to, You know what I mean? And then that way, every time we get money and awards, we can just divide it easily by those percentages. So more to come with that. So, not to belabor anything, but that's about it, I do believe. This mobile unit is a good thing from, Premier, they were here on last Friday. I think it was February 3rd that they were here. But they are at all the Ohio is Middletown Connect meetings, and they plan on coming out in the community and setting up these units, for people, blood pressure, cholesterol, whatever. And when they come out, you don't have to be a patient to a Premier group. They'll work with your own doctors or whatever to send the information they get. So, that's another good thing where you can kind of connect the needs of the community to these groups. And last but not least, I have this, I can send it out to the whole board, and I will, I'm gonna give you this, Nicole. But Shalom gives us a report on how they're doing an update. A lot of churches are involved, more churches than when Shalom had done it in the past. And, it's a big thanks. One of the big thanks in this article was Dave and Carol Schul, that used to be, old board members. They really help, Presbyterian Church is really helping in there, so. Do you ever get these updates by chance? And so I'll give you this hard copy, and I'll send it out to the whole board. But Shalom is back and, working really well again this year and, doing a good job, so. I was really concerned on some of those cold days that we had. Now we're supposed to have like spring-like weather for a couple of weeks, but, good mission. I think next year they'll even be able to be even more organized, and so, that's about it I have.
Okay.
Oh, we're meeting on Wednesdays now for the shooting, for the homicide that we had in Middletown. Paul Lawley has put together a task force Wednesday mornings, I do believe at 7:30.
Yep.
And so, more to come with that, but this is still, you didn't hear it from me, but it's being reactive. If you have a lot of social ills in your community, if we don't start kind of getting ahead of this, then it's kind of one of those things that happen after the fact, so we really need to make sure our community is healthy.
Yeah, and that's open if people wanna join that. He's called it Not in Middletown. I think the group has talked about just increasing communications between, different kind of diaspora within the city, and, whatever the group thinks is helpful to address the issues of things that we don't want to see in Middletown.
Yeah.
Homicides included.
Is that a good place to take the cat, coyote and stuff?
Nope, I don't think that would go over too well. Yeah. I think they're looking at a little bit
Yeah.
bigger.
Okay.
Yeah.
But another issue that we need to be mindful of, I just heard this, and this is what I mean by when you start listening to the community. We're getting a lot of people here that are, like Hispanic, Latino, etc., because, this is the exact wording that I heard, Hamilton's gentrifying everything and pushing them out. So therefore, when you tend to, if this is true and if this is happening, which if you look in the school systems and whatever, and then we have a new grocery store or whatever, so you can tell that your population is increasing, then do you start getting conflicts between groups because resources are decreasing? Those are things that you'll be able to see. So no one listens or does anything about it until you have some turf wars or you have different things. So you need to make sure you have plans for the changing dynamics in your community. So just FYI, those kind of things, because if the more service that you have, then people do that, and then it's lost resources. So whether it's perceived or not, you can be replacing people and et cetera, you know how that goes, so, anyway.
So if anyone is compelled to participate, 7:30 a.m. Wednesday morning.
Wednesday morning.
Police training room, so at the bottom of the basement stairs, there's a room.
And
You're
Paul said
welcome
it
to
may
email
change.
me, I can have him add you to the.
And he said location may change due to the size of the group, so I'll let you know too, but just,
Got it.
if you start there, somebody will redirect you.
Yeah.
Thank you.
Okay, so a couple things of interest in your packet. You have the influenza update. I don't know if this was touched on last month, but just kind of mapped out our influenza season, which some of you may know started pretty early and jumped pretty quick, but died off about just as quickly. So we're not quite done. Something still could happen with particularly B usually, but it looks like off significantly. The other one of curiosity is we've talked several times over the last couple of years about the impacts of COVID on our reportable illnesses, our communicable illnesses. And Butler County has in there their 18, 19, 20, 21, and 22 comparison. So particularly with 22 done now, you can kind of look back at some of the communicable diseases we're often talking about and see in tying in also the HIV, how we saw significant drops in 2020, presumably multifactorial probably of people not being out as much, but also people are not going and getting tested as much. And so then you saw this kind of sudden rise in our numbers back up that was a bit alarming, but when you look at the pattern overall now, 22's kind of settled in at either at 18 numbers or quite a bit below where 18 even was. So 2021 had us all a little bit, paying attention to the numbers rising and into early 2022. But 2022 overall has come out pretty much on par or better. So it's an interesting chart to look at there. And then lastly is the reportable illnesses for January, which had 25 chlamydia, 11 hepatitis C, 2 syphilis, 1 streptococcus pneumonia, and 1 HIV. There was also 1 hep B and hep A, but the 11 hep C is usually what we're watching, so that's my report.
Any questions from Dr. Genowine? Okay. Chandra?
Not a whole lot to report out, just that we're still offering COVID and flu vaccinations, which have both, the requests for those have both significantly dropped, but we're still offering the days, the first and third Thursdays, from 12 to 1, along with home visits for our homebound folks. So if anybody ever asks, yes, we do home visits for our vaccinations. And we are still offering test kits for free to anybody who comes to our window. And we actually have supplied Hope House and the warming shelters with test kits as well, so that they can make sure that they keep their population healthy. That's pretty much it.
Do they have to pay for those kits now starting in 23?
To be determined. Right now, the funding is still there. We are still able to order the free test kits. And since the pandemic hasn't been officially ended, probably not until that funding is completely gone.
And try to spread the word as a health board that we'll do whatever we can to make sure that people do not have to pay for those while we have supplies. And a lot of health departments have supplies. And so if we run out, we can get for the other ones before our residents would have to. So, because we just don't want them to sit in our office and expire, so we want to freely give them out and have that problem.
We actually talked about this at our emergency regional health, work group thing. There's some jurisdictions that have literally thousands of kits left, and they are expiring in April. So if we happen to run out, they are more than happy to give us.
Absolutely.
And did they extend the expiration date on most of those?
Some of them have been extended, and we have those, and we have to go online and look at the lot number, so a lot of them have been extended, yeah. I think we have some that's expiring.
All of ours expire in April. And I have not ordered more because I do not want to have that issue.
Yes.
But that is with the extension. They went from a 12-month expiration date to a 15-month expiration date. So, but I do verify those every time they come in.
Carla?
We are on target for finalizing our inspections the end of February. The licensing year ends in February, so we're pretty much on target. I think we should finish up no later than next week, all our required inspections for the food safety inspections. Amanda's still collecting also for the license renewals for the food service. Those have to be in by March 1st. We do have another micro market. Well, we approved the plans for a micro market at PCA on Baltimore. Also finally approved plans for Perez Grocery, which is on Vale. That's in the old UDF building. And Dollar General, we had an equipment review. They're actually putting in some coolers for produce on Central, so that'll be a little nice for that area. Isn't that in one of your?
Oh, is that what the semi trucks are there for?
They might be, yeah.
Sitting in, or the trailers are sitting in the parking lot now?
Yeah.
Where are they on Central? Where?
The
Like
old.
Craft
Old
Pot?
Dillman's.
Okay.
Yeah, Dillman's, yeah,
Gotcha.
old Dillman's, so they putting in a bunch of new coolers and having produce, so that'll be nice, I think, for that area.
That is one of the census tract
Census
areas.
tracts, yeah. And we also, finalized and issued a
Yeah.
permit for Primo, which is in Murphy's Landing, so I think they're actually having a soft opening today for Valentine's Day. And we are, I had mentioned about a house on Central Avenue. It sits way back off the road and they're on septic. The septic had failed and we had initially told the operator, not the operator, the realtor that while he was in the process of selling the house. The new owners were trying to get connected to the city sewer. There's one on Central, which is greater than 400 feet, and then they were also trying to connect through Bavarian, but Bavarian, they were charging them an enormous amount to connect and utilize their area of the sewer. So they decided not to do that. For what they said was like $90,000, the house is probably only worth like 100, I think, that they paid for it. So in talking with Scott Tadish upstairs, he had mentioned, after that, they decided they wanted to put in a septic system. But the system is an alternative system where we really don't like to have them install unless it's like your only option. It's a all-flat discharge system. You have to test the water quality, and it's just a system that we have those in the city, but we really don't necessarily like them, and then they also have to go through EPA for approval. So in researching, Scott found where they have a legal easement that they connect on the back of the property. So we're hoping that they can do that and get that taken care of, and it's a lot cheaper. So we're working with them on that. We were hoping that they were gonna connect a while ago, but they haven't. So just wanted to bring it to the board's attention just in case they decide to ask for some type of variance or something like that. So we'll keep you updated with that. And I think in the packet I also put in the new air quality. If anybody has any questions, I can try to answer. The air quality report from Hamilton County, Southwest Air Quality. There is a reduction in the complaints, but of course, we don't have that the blast furnace shut down, right? So that may be a reduction of the complaints, the coke oven.
Is there, I mean, these are all
These-
complaints,
yeah.
is there anything about like legitimacy or what the findings of the complaints?
I can get that from them, but
I just like to know if someone followed through with the
They
thing,
do.
because I don't know, citizens are like, no one ever does anything, and I'm like, well, I don't.
What do you do?
Air quality, Southwest Air Quality in Hamilton County, they go out to do the investigation.
So if it's I mean, let's say that the air quality's bad or whatever, I mean, what happens?
Well, they make sure, they make sure that they are, following all their EPA, permits. So I don't know how they, they may do some,
There's
they
like
do some
fines
Do they
testing.
get
and-
fines?
Fines,
yeah,
or
yeah.
anything?
Yeah.
It looks like there's a zillion of these complaints.
But they do, they have to, I guess, make sure that they are in line with their permits. So if they're not, then they will fine them and issue them a NOV, a notice of violation.
And there are air quality monitors set up
Throughout.
around that automatically report, there's even a dashboard you can, I mean, so it's not that it's not being tracked. Now, one could argue, did they put them upwind or downwind of the facility or not? That's been an argument, and were they strategically located? It's a good argument, and I don't have
You don't know where they put them.
Yeah. So,
And I think I could do, here's one, I think if you look up here, it says one notice of violation, that was for the Quaker, how you pronounce that? Horton, on 3421. And they usually, here's a notice of violation for that one
oh, I
business.
didn't see that at the top.
And they conduct the inspection and make sure they're in guidelines with the permit. And then if they're not, they make sure that they follow through. I mean, here's I can ask her if she has,
I
any
do know
paperwork
that
on those.
being on the SunCoke board, advisory panel, I do know that often when the opportunity arises, the facilities, SunCoke at least, will put in things that reduce odor, reduce noise, so they will report back out to us that we've done this, update to our processes at this amount of money to reduce this,
So you're not just taking up space, right? I mean, they do this and then something happens.
Yeah, yeah, so they do, I know SunCoke does, now I don't know some of these other places, when they say suspect, you see on the side where it says suspect, where the things are coming from, I guess they would have to, that means they would have to do more testing to make sure that it's, actually them, but they know who the suspect, people are. I mean, when you see suspected facilities, that's who it's coming from, usually, pretty much. And they make sure that they stay within the EPA guidelines and that they're notified, I guess, whatever. But, and we can you guys, if you wanted to, we can put that as that would be another opportunity to, put them on an educational moment, to have air quality come in to talk about this. We could put that on there. It's kinda neat, cause we could ask them about they could talk about their annual report, and you can ask any questions about anything else around the surrounding area, what they do. And we can put that on an educational moment too, so.
They just recently downed the stack, the paper, the one that was beautiful, and I wish they wouldn't have demolished it, but I think it was, so they changed to like electric, some of their processing changed recently. And I was told it should reduce odor.
The SunCoke or AK?
No, neither,
Cleveland Cliffs,
neither,
neither
but
one?
what is the facility that's right here, like by
Sword?
the?
Or Bay West, or, no,
Isn't that
Etsy,
Zaper
or
West?
it's called.
Yeah, Wausau.
Look, I'm naming all of them. I said Sword.
Yeah.
It was Wausau, but it's
Wausau.
Essity.
Essity, yeah.
Okay, that's why I was going through all of them, Sword. I know.
Anyway, for what it's worth, if anybody, that was very recent, like the stack came
Oh.
down, they changed their
Okay.
processing, so the odor in that area, I guess, should go down. I wish they would have made a historic landmark, it was really cool.
It was cool stack.
It's like a cool skyline kind of thing that we don't have anymore. It was also nice to see the predominant winds if you're.
Oh, okay.
Well, the complaints are definitely less than what they were, excuse me, I'm sorry. The complaints are definitely less than what they were last year, so, if that's any consolation.
I understand Cleveland Cliffs is getting ready to put in a multi-million-dollar expansion. Does that
Where'd you
involve
hear
us
that?
at all?
Where did you hear that? I'm just curious.
There's no such thing as secrets, Nicole.
An engineer that does some consulting work.
Okay. Recently? Okay. Cool.
I always sound like,
Been radio
since
silence for a
Facebook is
while
out,
on it,
every
so.
time they say that, like they'll say crime scene is secret, I'm like, ain't nothing secret anymore, everybody takes pictures and them out, there's no such thing as confidentiality or what it's not confidentiality, what is it? The only thing you can maybe get covered is if it's HIPAA, everybody hides behind HIPAA all the time, we can't tell you that because it's HIPAA, I'm like, this has nothing to do with health information. But anyway.
Carla, do you have anything else for us? Okay, anything anybody wanted to?
Let's sit around the bush and ask what you think.
They use HIPAA for everything.
Oh, yeah.
I know,
And threatened with everything.
Yeah, I mean, it's.
Where was my husband last night? That's HIPAA protected.
The funniest is when it's you wanting to share information with me, it's your data, you can tell me anything you want, that's not protected by HIPAA, you're allowed to tell me.
Anything else anyone has for the meeting? Okay, the next meeting will be March 14th at 7:30 a.m. I will not be here for that meeting, so,
Dr. Patrick.
yeah. Woo-hoo, I see you've got your Robert's
I'm
Rules of
busy.
Order. You need to school me on that. Okay, then we will officially adjourn the February meeting, and I will see you guys in April, but in the meantime, feel free to reach out to me with anything.